and welcome to this installment of Frank and Mary here in Southborough. If you haven't seen the show before, my name is Art Bergeron. I'm an attorney. I do elder law. I work at Myrick O'Connell. There are 70 of us, so we all get to do what we like. I like this, but as you know, this show is not about elder law. It's about my friends Frank and Mary. You've seen these folks at the presentations I do at the Senior Center. Frank and Mary, their goal in life is to live in their house until they die, be buried in the backyard. And if that's Southborough, that means they want to stay right here. And so the purpose of the show is to let you know the people you need to know and the programs you need to know about in order to do just that. And if you're Frank and Mary and you're going through COVID-19, this is the COVID-19 edition of Frank and Mary. We've been doing these shows more because life is changing for you tremendously and you're the most at risk as seniors. So as you all know, my wonderful co-host is Doug Peck, who lives here in Southborough. His day job, he runs this great organization called Seniors Helping Seniors. We've talked about that before. But his job in this show is to find these great guests. And he's done it again today. Doug, whom do we have today?
I have actually two guests today because I think they both bring some very important information that people need away. The first one we're going to speak to is Joe Quirk. Joe is the brand new executive director at Bay Path Elder Services in Marlborough. People need to know that they're still open and what services they have and how they do business right now. The second one is Emily Amico, who is the new public health nurse in Southborough. And she also has some very important information for folks to know. So let me introduce Joe. Hi, Joe.
Hi, thanks for having me on.
Oh, you're welcome. So I understand that the physical offices are sort of closed. There's nobody sort of going into the building anymore, like most places. Is that correct?
Yes. So we are an essential business because providing care to people in the community is considered essential. It is. So we've remained open the entire time. In the office itself, we have just a handful of people working, receptionist, myself. We sort of alternate different days, so there's always someone there. But most of our staff are working remotely from home and interacting with consumers in the community, all remotely using the telephone. There are no in-person meetings or visits to people happening right now.
Okay. So when people, particularly somebody new wants or needs a service, they call the Bay Path number, which we'll put up on the screen afterwards. And then what happens?
Sure. So they call our main number. The receptionist is there. They will probably be forwarded to a voicemail where they'll leave a message just with their name and phone number and maybe a little bit about what they're calling about. Mm-hmm. And one of our information referral specialists will get back to them. These are people who are trained to really listen to callers to try to understand what they're interested in, why they're calling, what their current situation is. And then they work with that person to develop an array of resources and different services and things that might help meet their needs for whatever it is they're looking for that day. We have a large database of resources. So, if it's out there for seniors, we know about it. Sometimes those things might come from Bay Path, and other times we refer people to other agencies. But a lot of different kinds of service and supports can be learned about from the information referral team.
Oh, good. And they'll call back right away.
Absolutely. Yeah, we'll call you back the same day.
You're not going to have to wait a day or two.
No.
Okay, excellent. And what about somebody coming to people's houses? I know seniors are nervous about having somebody come and meet them. So how do you do that nowadays?
That's a great question. So all of our services have been continuing to be provided. We do provide many services in the home, home care aides who help with homemaking and personal care and other kinds of in-home services. Many older adults are concerned about the exposure to COVID-19, and they've asked right now that their services be on hold, and they are. But the majority of people we serve are continuing to get those services. In addition, I should say that we have a lot of contactless services. So I think right now I'm concerned that people might need services and not be calling because they're afraid of having contact with people. And I want to say about that first of all, when we talk now to people about their interests and eligibility for programs, it's all over the phone. We don't come to people's houses to do that. And if they qualify for our services, we have a lot of services that can be provided without anyone actually going in the home. So home delivered meals, grocery shopping, laundry, lifelines. There are a lot of different services that are just delivered to the home, but people aren't going in the home. And then for those who are getting services in the home, I should emphasize that the aides that are going out to provide these services are well-trained and well-equipped on how not to spread the virus. And they themselves would never report to work if they weren't feeling well or someone in their household wasn't feeling well. So even though, and I'm sure Emily will have a lot more to say about this, but even though we can't eliminate the risk of infection when people are providing services in the home, we've done everything in our power, and our providers have, to minimize that chance as much as possible. And we were just getting statistics from the Executive Office of Elder Affairs recently that said in our whole home care program, we track this, there have been, I think, 543 COVID-19 infections out of a population of seniors getting services of about 40,000 or 45,000 a month. So we've been successful, I feel, at doing our best. Again, we don't eliminate the risk entirely, but we've reduced it as much as possible. And then, of course, the contactless services, there's virtually no exposure in those instances.
So people shouldn't hesitate to call you if they need anything, even if they're brand new. Particularly nowadays, I know you've had a lot of requests for Meals on Wheels. And that's still very much an ongoing situation, correct?
Absolutely. We have reduced delivery to 2 days a week, but we deliver the 5 meals on throughout the week on 2 different days. Again, it's sort of out of an excess of caution to reduce the number of times we're having contact with people, but all those services are still available. And I think, even if they have needs now, but want to think about when they want to start services, I would encourage people to call and talk to us and help them figure out, what we might be able to do until they're ready to receive more.
I think
Go ahead, Arthur.
I was just going to say, Doug, but I think that's a really good point, that for a lot of seniors who have been kind of stuck at home, and even if they were just afraid to go out. They're just afraid, as well as being afraid of letting people in. But I think many people are now more taking a breath and saying, okay, we feel like in many ways, kind of a lot of the really bad part is past. And they're trying to reimagine their lives now. So to have them at this point kind of reassessing and saying, there were these great services at BayPath, either I've been using them and I dropped them, or I've heard about them, or I might want them. This is a great time to be going back to their website and to be talking to them, because I think one of the BayPath has been such a crucial player in so many of our communities. And by the way, just a plug to the superb chairman of the board of BayPath Elder Services, who is and when is your term ending, Doug?
No, I'm not chairman of the board. No.
You what were you were?
No. Yeah, I've been promoted to vice president of the board. So
vice president of the board. I'm sorry.
That starts in August. Okay.
He's climbing the ladder.
But that's a much lower pay scale, though.
Right? It is.
So,
yeah.
but the point is, this is as Joe started off by saying, this is the place where you could find, no matter what the services are that you might need, either they provide them or they know where they are. So at this point, it's a great time, and their services. And I was just going to kind of throw in one other question. I'm just kind of interested in, do you anticipate your service mix changing, or do you anticipate some of the things that you're doing, like, for example, the contactless things, the ways that you're delivering some services, continuing, as things change?
Oh, I think all those services will continue. We have, the state has added new ones that we can provide. So there are different kinds of telehealth and telemonitoring that we are now able to provide that we weren't able to provide before. And it's all in response to trying to meet people's needs, without, having to see them in person. The other thing I'll say too, and I think, calling us to talk about plans for the future is a good idea as well. I mean, I think that now more than ever, people prefer community care to nursing facility care. And I think that, everyone's seen how devastating the virus has been within nursing facility settings. It's clear that getting care at home in that regard is obviously much, much safer. But I think a lot of people wait sometimes until there's a crisis before they call us. And I think, don't wait till then. call us and talk to us, and we can, help you figure out what your goals are for living your life. And hopefully we'll all, live long lives in the community. And at some point we all are going to need services if we live long enough. So it's maybe a good idea to sort of talk to us about what the community options are and maybe start planning for some of those things, sooner rather than later.
I think that's a great point. And Arthur, what you mentioned too, people want to stay in the community. Well, you don't wait for a crisis, for something, for you to be planning for something. That's the wrong time. So even if you contact BayPath and you begin to use one of their smaller services, you're in the system. People get to know you. You get to know experience with BayPath, what's working and what's not working. And so you're better prepared for the future, because we really don't know what the next 6 months or the next year is going to hold, particularly for seniors, until they get and Emily can speak to this well, until they get a vaccine, and that easily can be a year away. And even then, it's still very early days. So I think people really start to need, hopefully this is, giving people the idea that I need to plan a little bit better, really understand what's out there that can help me stay at home.
That's a great point. And please go ahead, Arthur.
No, go.
I was going to say, I think that's a great point. We see this a lot with people. We might begin with them, providing inpatient referral. Then they might start receiving home delivered meals. And as they get older and need more help, we provide homemaking. Eventually, we might be providing personal care. And then someday, we might be providing, 12 hours or more of care a day to help people stay at home. And it happens, we're sort of with them through the whole aging process, supporting them and helping them stay where they are.
Yeah.
And I think, Doug, I think both of those points are really well taken. I think the notion of be in the system, it's like kind of getting to know your doctor. One of the reasons why you can count on your doctor is that your doctor knows you, and your doctor has known you because they've been with him for a while.
Right.
And you get used to being with this agency, and they're going to know you and you're going to know them. And then it relates to the other issue. Nobody wants to go to a nursing home. I've had, as of last week, I had 13 clients that had died.
Wow.
Through COVID-19. And 11 were in nursing homes. And people are, not that, it's just that it's dangerous. In the best of circumstances, it's dangerous. So for people who are really consciously saying to themselves, I'm healthy enough, I don't want to go there. Well, in that case, plan for it. As Doug, just as you said, don't put yourself in this emergency situation. You're in the hospital, something bad has happened, the hospital needs to discharge you. Oh, what do? Well, if you don't have a plan for them, their plan may very well be that you're going to a nursing home for a while. So, you figure out, I think it's great advice. Joe, I think it's really good advice.
Well, Joe, it's been really great to meet you. And I think I really know that BayPath is in good hands as we move forward. It's been challenging times for everybody, but Joe's got a great deal of experience with EOEA, Executive Office of Elder Affairs, and other senior associations, ASAPs. So I'm really glad that he's on board, and we're going to be moving forward in a really fine path with BayPath coming.
I just want to know how he looks so young with that much experience. How did he manage to do that? So Joe, thank you very much. Thank you very much for being on the show. I know that you're going to be unplugging while we talk locally to our guest Emily Amico. But we'll look forward to having you in the future. And please feel free, as things are changing at BayPath, let us know, and we'll bring you back on so you can talk about how things are changing. Okay.
Absolutely.
Thank you so much. Thanks for giving me an opportunity to talk to you all today, and give BayPath a call, everyone.
Okay.
Thank you.
Thank you.
All right, Emily. Hi.
Hi.
Emily.
Emily is a new, brand new almost to Southborough. So tell us just quickly, Emily, where did you come from?
Well, I have been a nurse for over 20 years. I'm a Massachusetts native, and after I graduated from UMass Amherst, I moved out to California and then lived in New York City for a little while. And then when my husband and I started our family, we moved back closer to home. So
Nice.
Yeah, so I have 3 kids. I have been working now in public health, like in the community, for a few years. I started by going back and working in my kids' schools as a school nurse, and the last couple years, I've been working in local flu clinics, and most recently, I worked closely with the public health nurse in Sudbury,
Okay.
and I was her right-hand man, as you would say. And then I had the opportunity to come to Southborough because Leslie Chamberlain was retiring from the Board of Health. She still is at the senior center in a partially retired position, so but still very actively involved and a great mentor. So it was a great opportunity for me to step into a bigger role in public health, which I really enjoy. And the last couple of months, I've kind of started off running because of what's been going on in public health. And I was originally supposed to start in April, but I came on board in March to help with case investigation and contact tracing locally. So.
Oh, good. I know Leslie's been a really big part of the senior center and the health department. So you're filling big shoes, and I think that we may have you back on at other times too, because people really rely on the public nurse. Seniors do anyway, I know. What if we're going to be doing some contact tracing in Southborough? From the sound of it, we are.
Oh, yes, it's been active since the beginning. That's part of the public health nurse role. Disease investigation and contact tracing for some of the diseases, things like pertussis, and there's a multitude of diseases that are followed by the Department of Public Health of Massachusetts. So we're kind of an arm of that, and on the local level. And then with COVID-19, it just, obviously with the pandemic, you need all hands on deck.
So I was going to ask you about, if you don't have a lot, you don't want to go here, but about testing. So I think a lot of people, particularly seniors, want to know, so do we do testing, the public health department? What are the tests that people should get, or should they be getting tested?
So testing is something that you should discuss with your primary care physician. Or whatever practitioner that you see regularly. Testing has expanded for COVID-19, as I'm sure you've read in the news. Initially, it wasn't readily available, and only if you showed symptoms were you tested. Now, they are testing individuals who are close contacts of people who are tested positive. So. If you are a household contact or you have been identified as a close contact, then you would be tested as well. But it's something that you have to have a doctor's order in order to be tested.
Okay, I was going to ask that. They still have to have a doctor's order.
Yes. So. There are some urgent care facilities that do testing, drive-up tents, but it's the same as if you went for an urgent care visit, you would be screened through a practitioner, and then the test would be ordered. And that is for the nasal swab. And that is the most accurate test that they have right now. There's also a lot of work being done with antibody testing, which is a blood test. And there's so much still to learn about so much of COVID-19, but the antibody tests, they're learning more every day. To determine whether it shows short-term immunity, long-term immunity. And of course, it takes time to get that data. And since we've only known the disease for maybe 5 or 6 months, we don't have that data yet.
So the message is, there isn't a magic bullet yet.
No.
You be careful. Even if you end up getting tested and it turns out you've had it, you need to continue to be careful.
Yes.
So can I?
Yes, go ahead.
No, I was just going to ask, just following up on what Doug was saying. So in terms of, so 2 questions about testing. First, is it if you've got that doctor's something, is it is it free? Is it all covered by is it covered by all health insurance? Does Medicare cover it? Is it covered? And where would you go? You know, if you were around here, if you were just saying, I just want to be tested, you know, I'm nervous, I want to be tested, where would you go?
So the insurance piece, I'm not sure about the specifics of that, but Southborough Medical actually has a tent there where they are testing out on their property. So many residents go to that practice, the Reliant Medical, Southborough Medical, and
I
a
saw
lot
it
of
the
people have
other day.
been going there. So you can
Right,
call
you
your doctor and they guide you around the corner.
Right. All right, good. So what, it's also coming into flu season, right? I mean, shortly. I know,
Yeah.
when are you going to get the new flu vaccine? Is it usually August or September?
So we are preparing. We have placed a preliminary order for flu vaccine, and it's hard to predict how many people are going to come. We have already upped our order 20% from last year, but I'm in contact with the pharmaceutical representative who supplies the town of Southborough, and we're discussing how much more we should get. So it's an active conversation, and hopefully we will have our plans for our flu clinic midsummer, I would say.
So
Give us
seniors
6
should
to 8
definitely
weeks.
take
We'll have all the information out for
Yeah.
you. And then I'll be back on and be able to talk more
Yeah.
to it.
Well, seniors should definitely get a regular flu shot still. That's very
Yes.
important still.
Yes.
Okay.
Yeah.
So you're thinking maybe a drive-through clinic, or you don't know yet, or we're going to wait and see?
Other local communities are talking about that, so we are looking into that being one of the options.
Okay, good.
Yeah.
Good.
And so from your perspective as the nurse, right, as you're seeing, as we've been talking about the fact that things are kind of opening up and things will probably continue to open up. And now we do have this understanding. One of the things I think we do appreciate about the disease is it really affects older people. You know, I mean, I was just doing the numbers with my wife regarding the chart that the Department of Public Health had as to deaths, you know, by category, you know, 40 to 50, 50 to 60, 60 to 70, 70 to 80. And what was the number? 60, 70% of the deaths were over 60.
Yeah.
You know,
Yeah.
they were a huge percentage.
Mm-hmm.
So we're the ones, I'm 70, right? I'm an old person. You know, we're the ones who are going to kind of remain exposed as everything opens up, right? So from your perspective, you know, you got any kind of tips for how this should be playing out over the next months, you know, until the vaccine shows up? What should people be doing?
Practicing social distancing and good hand hygiene is what I'm telling everybody. And if you can't be 6 feet away from people, wearing a mask and avoiding touching your face when your hands are not clean. And making sure you wash your hands with soap and water for 20 seconds of scrubbing. And if you don't have soap and water, have hand sanitizer available. And it is coming back into stock. So there was a shortage for a while. I think maybe some people were stockpiling. I don't know, but it's coming back into stores. I've seen a lot of it. So using hand sanitizer, again, for 20 seconds, getting it all over your hands as if you were washing them in between your fingers, the backs of your hands, and making sure it fully dries.
So your message is, even though we may see other things opening up, restaurants, etc., still for seniors, it's really important to keep practicing what they've been doing, hopefully the last couple of months. Don't really go out into the public for indoor spaces if you don't need to. Wear the mask. Be cognizant of where you are, particularly indoors, right? I mean, outdoors is a little bit better, right? Is it?
Yes.
Okay.
Well-ventilated areas are ideal. So outside, obviously, is a great place to be able to visit with people.
Mm-hmm.
my parents, who are in their 70s, have just started coming over, and we've had driveway visits and yard visits where they watch the kids play ball in the yard. And we're still practicing our 6-foot distance and wearing our masks just in case we come in closer contact. But I still haven't gone to see my 90-something-year-old grandmother yet. I'm a little bit hesitant, but I'm itching.
Yeah.
And she finally got her hair done, so she wants to come over.
And for the washing hands, Doug, a friend of mine said, wash your hands as if your mother were watching.
Yeah.
You know, like all those things that you learned to do, you know, and you kind of forgot them, right? From when you were a little kid. So Emily, thank you very much for doing this.
Yeah.
You know, we really appreciate it. And as Doug said, you should really come back on, because I think this is going to be an ongoing issue, you know, for seniors. And as flu season comes up and new things come up, this is going to be really important that they feel that there's a number that they, and can you, by the way, you know, we'll post your the number that they can call and your email address and stuff on the show, you know. Yeah. So thank you very much. And thank you to Doug Peck. So you continue to do this, you know, every single time we get these great guests. So I really appreciate it. And thank you to the folks at Southborough Cable for being willing to do this. You know, we're really, you know, they've been really helpful and really helping us provide what we think is really an important service for seniors during an important time. So thank you very much. Thank you, Doug. Thank you for watching, and we will look forward to seeing you on the next installment of Frank and Mary here in Southborough, the COVID-19 edition. Thank you.
Take care, everyone.